Hello everyone, welcome to my channel again. I'm back again with a very important topic, something that has been an issue lately. Yes, recently I heard about the outbreak of cholera in some parts of Lagos. I think so, yes. And I decided to make a video on that to create awareness and to also let people know what cholera is and how deadly it can be. Now, cholera is a highly infectious disease or infection caused by Vibrio cholerae. That is the bacteria. That is the name of the bacteria that causes um, cholera, and it's usually found in feces. That is the poo. That's what we know it commonly with. So it's usually found in feces. Now, it is characterized by some symptoms like diarrhea, vomiting, rapid dehydration, fever, abdominal cramps, and so on and so forth. So once you see some people who are infected with cholera, they usually vomit and it's always projectile, and they are always diarrheating. They will be going to the toilet after every time, every now and then, and the poo or the feces are usually pale, watery, and so frequent as well. So the person is always using the toilet. As the person continues in this way, it leads to dehydration, and this dehydration, that is the major thing that makes it to be so terrible to the system. So that is that. If you leave cholera untreated, it can lead to severe dehydration. And severe dehydration is so bad. Can imagine when there are no fluids again in the system. That is shut down, total shutdown. There will be organ failures, shock, even death in within hours. Yes, we have seen so many people who have been recorded dead after few hours, like 6 hours of severe diarrhea, dehydration, and all that from cholera. Yes, it happens. Cholera can be that dangerous and life threatening. So it is something we need to actually try to fight off instead of looking for treatment. We need to fight it. Now, the way it is transmitted by contaminated food or water, poor sanitation and poor hygiene, direct contact with infected feces or vomitors. There are risk factors that can actually aid the prevalence or the outbreak of cholera. And these risk factors include poor access to proper sanitation and clean water. Yes, there are some areas in our country or in our world today, they don't have access to good water. And this is very terrible. If you are not having access to good water, safe water, you would be at risk of this kind of infection, deadly infections. So you need to watch that. Then another thing is crowded living conditions, like places where there are so many crowds, maybe a community or a particular town where they have so many people. The way they built the houses are so jam-packed. People are like the ones they usually say, face me, I slap you, All those crowded living conditions can be a risk factor to getting cholera infection. Then another thing is malnutrition. People who are malnourished, they are actually at risk because they are so vulnerable. Their immune systems are so down. So once this kind of people get this vibrio cholerae, they are prone to having these symptoms and could even lead to death if left untreated. Then another thing is weakened immune system. There are some people who are actually battling with some diseases or sicknesses before the outbreak of cholera. So such people have already developed an immunocompromised condition. Their immune system are already compromised, not strong enough to fight off infection. So once these people, they are at risk to be infected with cholera bacteria. Now, another thing is that the main aspect of the treatment or whatever of the cholera is that the person needs to go to the hospital. You don't manage it at home. In fact, I don't even advise you manage it at home. The first thing you can do, maybe it started off in the midnight, maybe your child started stooling and vomiting in the midnight. I always tell parents to have this ORS at home. So if it's it started in a time where you can't really access the hospital, please get the ORS ready and start giving the child. Then once you have the capacity of going to any health facility, you take the child immediately to the hospital for proper management, because cholera is not something you should joke with. You need to rush straight to the hospitals so that the doctors know how to treat your child or treat you if you are the one who is infected or who is having those symptoms. They will be replacing the fluids you have lost. They will give you some drugs, whether by your veins or whatever. They can even set drips for you. The ones that are good for you, they will do that to make sure you get back to your feet. But please do not treat any symptom that looks like cholera at home. It is very risky, so you don't lose yourself or your loved one. Then another thing is that you need to practice good hygiene. Practice good hygiene. Always wash your hands. Wash your hands regularly, especially after using the toilet. You know, I told you that this vibrio cholerae is always found in feces. So if somebody who is already infected with a bacteria, the person will always be sharing it up and down, like some villages where they go and defecate in the river, and somebody who is far off wants to drink water and goes to that stream or that river to take water, the person will also be infected. So it is better you practice good hygiene. Also practice the use of safe water and dispose your waste very correctly. In fact, defecating in rivers is a no-no. It's very wrong. Let's practice good hygiene so that we would not be infected with any infection. Then another thing is avoid contaminated food. Know the way you handle your food. When you buy fruits from the market, when you get home, wash them with salt and make sure they are clean before you consume them. Then in some high risk areas, vaccination is also important or is advised to prevent these illnesses or this cholera of an infection. So please, let's be aware of how cholera works. If you have anyone who is showing symptoms of cholera, please take the person straight to the hospital for proper management. And please, let's stop building or making our latrines, like some areas that where they use latrines. Let the latrines be far from water sources, at least 30 meters away, so that you would not be at risk of contaminating your water or the community's water. Because once a person gets down with cholera, in fact, people around that person are at risk, high risk. So you need to watch that. Cholera is very deadly and it is life threatening. Let's fight it off out of our community. And we are also I'm also using this medium to let the government know about this and to also help some communities to get access to good and safe water, and also to provide proper sewage disposal means, so that people will not get down with this kind of outbreaks that can make them lose their lives. So please, everyone, be careful. When your children get back to school, let them wash their hands. After using the toilet, wash your hands. Wash your hands regularly with soap and clean water to stay healthy and also to avoid being infected with cholera. Thank you so much for listening to me today. Remain blessed. Till we meet next time. Bye bye.